Liebregt and I'm from Holland. I'm 36 years old and I'm now here in India, in Artemis, because I got in 2007 the diagnosis MS. And the last 2 years I think it went really fast downhill. So that was when I decided to explore stem cell transplant. And by exploring I came to Artemis, to India. And the fact that I saw it was in India and in New Delhi made it also really special to me, because I was born in India, and when I was 3 months I got adopted to Holland, and it feels like getting back to where I once began to get a new second chance. So it's really special to do this here. The reason why I decided to explore the stem cell transplant is because the MS really got a big influence in my life. I needed to stop work. I couldn't make some moves like open bottles, and it really influenced my life, my daily life. Doing stuff wasn't that normal anymore. It went with a plan. Like normal walking became with a crutch or a wheelchair. And thinking about what else could become made me really scared. Now I had a little bit independency, but in a rate I was going down. It was really scary to think about how fast even that would disappear. So that's why I applied to Artemis, and I really hoped they would accept me for the treatment. So when they did, I got the email. I was really happy, because it felt like I could be in charge of my own life again. Do something instead of just overcoming the MS. 20th of March, I came here, and it was mind-blowing. It was really different than I would have expected. We came in the night, so it was really strange coming in. But I think really quickly, a few days after seeing many nurses, but also talking to the doctors, the trust really came, and I really felt in good hands. The doctors are really explaining everything with much patience, and even if I ask a question they already answered a day ago, they will do it again. Also with the treatment, they can explain everything. If there's a new phase, they can tell me, this is gonna happen, Linda, and this is gonna happen, this is gonna happen. And when I'm in that phase, then you see everything happen, but then in my mind I have the voice of the doctor, oh, it's okay, it's okay. They are prepared and they know. I really feel I was in really good hands with Dr. Pawan, Singh, and Dr. Ragesh. They really took care of me all the time.
We have Linda with us, who is diagnosed as multiple sclerosis, and it's a long story. She's having this disease for quite a long period. She has received multiple treatments, and now because her symptoms were not under well control, so then after failing multiple therapies, so she decided to go for this Autologous Bone Marrow Transplant, or the hematopoietic stem cell transplant. So which is currently, we can say that it is still experimental, but very good results coming out in recent years. If we see a lot of studies are there which are showing promising results. So that is why she decided to go for this autologous bone marrow transplant or the Haemato HSCT?
Linda and her best friend Leonie came to India from far away from Holland for this transplant, hematopoietic stem cell transplant, autologous for multiple sclerosis. Her clinical course was totally uneventful, and she tolerated everything like very easily. And she is, I have told her she looks like more radiant than before when she came here. She looks more fit, more bubbly, and more cheerful than when we started off. Probably she was tense when she came, but she understood that this is not so bad as she might have imagined.
So I'm here with my friend Linda as an attendant, and we experienced the last 5 weeks as it was a difficult treatment, but we felt very welcome, and the service was really good. So when you press the alarm, the nurses come very quickly to help, and when there is an emergency or we really need help, then they're like so quickly, and it's really nice to see that they really cooperate, they work really good together.
And with the whole team, all the nurses, they were really caring, really sweet, and really personal, even involved, I think. So I'm really happy that they were the persons with me in this whole process.
So we wish her very fast recovery, and we had a nice time with you and Leonie, both of them. And I have told her that what she will do, she will come back to India after maybe 6 months to 1 year by cycling all the way from Europe to India. Okay, so we wish you both of you good luck. Okay.
The most impressive about this whole process, this whole treatment, is the care I felt. The nurses who stood by me when I had to throw up, they would put their hand over my back and they would stay with me and let me really feel that I would not be alone. They were with me through all of it.
And they really know what they're doing, so that's really nice to experience. It gives faith because sometimes you can be scared in a difficult treatment like this, especially if you are the person that gets the treatment. And it's really nice to get the confidence from the nurses and also from the doctors. They come 2 times a day, in the morning and in the evening. And yeah, you really feel like they know how you're doing and if anything is needed. And they're also really funny. So because it's a serious treatment, it's nice to also talk and make jokes. And at the other side, you're just in a room for 5 weeks, and the service is really good. So you have a TV, you have the internet, and yeah, the 5 weeks actually went pretty fast. And it was a good experience. And I can imagine if you come from a different country and you're thinking about the treatment going to India, you can have doubts, maybe because of the country or hygiene or whatever. Actually, it's a high quality treatment and it's a really good treatment and they really know what they're doing. I think they are the experts in this treatment. And we felt safe, and to say she actually already feels a difference with walking, with bending her knee. And we know we need a few more months that we can really say what is the result, but we are already really happy.